Gentlemen, thank you, Mr. Chairman.
Thanks very much. Senator Lee.
Thank you, Mr. Chairman. I'd like to follow up on the point made by Congressman Mulvaney. We've talked a lot about R&D tax credits today, and I understand the allure that those credits hold for this industry. And there's no one who wants more to incentivize and encourage research and development, particularly in this area, than I do. And at the same time, I share many of the concerns that I think were underlying Congressman Mulvaney's questions, and that I wonder whether we couldn't benefit from an effort to simplify our tax system, even if, as Dr. Tang points out, it's not the way the rest of the world does it. It seems to me to be one way in which we could offer some value added to would-be investors to invest in the United States. So, Dr. Sands, I was noticing you pointed out that investment in this area really requires foresight, not just of a few years, but of several decades. Mm-hmm. With an R&D tax credit, with a tax credit of any sort, even if you build into the law the ability to carry forward the benefit of that 25 years or so, that further complicates an already extraordinarily complicated tax code, one which, when considered together with all of its implementing regulations, occupies tens of thousands of pages. And nobody's ever read the whole thing. If they did, they would promptly die. Just like, as I'm told, the guy who ran the first marathon collapsed and died right after. Very sad. I ran a marathon once. I did not die, but I felt like I was going to. Anyway, Dr. Sands, my question is, in light of your comment about how this requires foresight of many decades, don't you think we could benefit from moving toward a simpler tax code, one that tries to flatten out rate structures? It seems to me that regulatory and tax simplification could perhaps give the greatest degree of assurance, of certainty that you would need in your industry.
Yes, I mean, unquestionably, the simpler the better. But I have no idea how to accomplish that. I've never seen that done before. But if you guys can do it, that I think you should. Now I can say from the industry perspective, whatever can help not only the small companies but also the large companies view research as a long-term investment worth doing. Those incentives, if it's worth having something special, I think this industry is unique in that the basic unit of time is the decade. It is, and that's a different way of thinking than most industries. And given that it's at the core of health costs and other things, it may be worth some special attention, but I can't tell you how that could be done.
Okay, thank you. Another area that I'm always looking to, I always like to try to look at areas within government where we could simplify and roll back things that government does that make things more complicated. I like government solutions that don't cost us money in order to implement, but that will yield a benefit to you. In this industry, and this question is open to any of you who have an opinion on it, is the current patent structure that we have in place for pharmaceutical products sufficiently long to enable you to recover what you need to recover for the products that you're now developing?
No, it is not.
What would, in your opinion, be a better solution? One that would still take into account the goal of not holding drug patents open perpetually, but would be more suitable toward allowing you to recover your investment?
Well, I understand the difficulties in extending patent life from a statutory standpoint, but I think data exclusivity, time periods, regulatory exclusivity perhaps would be more manageable, and I know people have tackled that with regard to biologics. And I think it should apply to small molecules because the extended regulatory hurdles that we have to overcome, for example, in diabetes, in diabetes trials, eats into the patent life, eats into our time frame to actually get a return on the investment. And as I said earlier, these numbers are very real. Our phase 3 trial alone is $200 to $300 million in type 2 diabetes. And if you want
And the entire time the clock is ticking because you've
you're
filed.
burning, yeah, not only the dollars, but you're talking about a 3 to 4 year just phase 3 period. And we filed patents 7 years previous to starting that. So you've burned up 10 years of your patent life before you even get on the market, at least. So this concept of a 20-year patent is pure fiction. It really does not help you during the vast majority of your time there. The other thing you mentioned about saving money and simplification, if you can cure diabetes, you will save the federal government billions and billions of dollars in terms of health care. You're talking about 35 million Americans with diabetes right now, going up to 50.
You're talking about type 1 or type 2? Or
Talking about type 2, adult onset diabetes, and the drug we're working on, by the way, should work in both.
Great. Happy to hear that. I see my time's expired, so thank you.
Thanks.
Thanks, Senator. Congresswoman Maloney.
That's a great question about